So we have to make sure that we learn about acute, subacute, and chronic conditions, because while we are coding, we usually get the difference between acute and subacute and chronic condition. So what do you mean by acute and subacute and chronic conditions? Means acute is a sudden problem or the recent onset issues or a short term conditions. So whenever there is a sudden issues or short term issues or a recent onset or a recent encounter, then we are going consider it as an acute condition, which is a time duration usually between 0 to 2 weeks. We are going to consider it acute. And when it comes to subacute, which is in between of acute and chronic, so let me not explain you subacute right now. Let's go for a chronic and then let's move again back to the subacute. Chronic is nothing but it's a long term issues or ongoing issues, which is persistent condition which is more than 3 months. It could be years. For example, diabetes mellitus, hypertension, all these are the chronic conditions. So now we got to know the difference between acute and chronic. Acute is a sudden one and chronic is a long term issues. So the duration, as I told you, acute would be for 0 to 2 weeks and chronic would be for more than 3 months. So now subacute, which is in between acute and chronic, we are going to consider a subacute condition, which is an improving, which is not fully resolved. So around 2 to 4 weeks, we can consider it a subacute conditions. So for example, patient had a back pain since 2 days. So back pain since 2 days means we can go for acute. If a patient is having a headache ongoing for 3 weeks, then ongoing, then it is still not resolved, then we can go for subacute. If a patient is having diabetes for 5 years, it's a long term condition, then we can go for a chronic conditions. So these are the three difference what we are going to concentrate on the ICD conventions.